Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing Medicare and the marketplace. In today's current environment in the world, in our country particularly, this is a very pertinent topic where people are looking for coverages that best suit their circumstances, and for those that have been seeking coverage and having coverage in the marketplace, may be particularly confused as to what their next steps are as they enter into coverage through Medicare. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. And will be presented in a fashion that some folks might find a tad remedial, some folks might find a good review, and some folks say, wow, this is new to me. But we're looking to address as many questions and cover as many angles as possible for the agent population that we serve as well. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the questions box. We find that we do answer most of them through the course of the presentation, but we'll make certain to address them so you get the full return on the investment of your time with us here today. With the preset I had with the different varying amounts of experience with people in different areas, I want to do a little bit of level set to start out with who Premier Marketing is very briefly. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform, licensed in all 50 states. We act as an insurance wholesaler, working through independent insurance agents such as yourself, and we do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. That portfolio that we offer is aimed at this target market, and it carries with it the different coverages that are most in demand by the folks that we speak to on this topic of Medicare and the marketplace. So it has the base Medicare programs, the life insurance pre-need plans, long and short-term care, disability income programs, and ancillary benefits. And it does so through a big portfolio of Medicare Advantage programs where the national carriers are there for you, along with many of the smaller regionals that make a difference for you in the market. Same philosophy in the prescription drug plans, where these are normally part of the contract with the Medicare Advantage carrier associated with that plan. A couple of exceptions. Mutual of Omaha is a separate contract. Clever RX is a discount program and not a standalone Part D plan. Medicare supplements. This may very well be a viable choice for many of the folks coming off the marketplace plans. We have a large portfolio of programs here for you as well, and support programs to help you be successful in this space. And we go through all these different products because they are of need-based to a population that may be looking for more extensive coverage than what they had under the marketplace, maybe looking for different assistance programs than what they had with any type of credits that were used in the marketplace. And we want to make certain that we can address areas of specific need as well as dictated by our audience. And that includes in each of the ancillary product areas, the national carriers that can make a difference for you and your client base. You're serving that need. It gives you greater opportunity to market, and it also creates an additional revenue stream for you and your agency. One of the things we have when we enter into a discussion with folks that aren't as familiar with Medicare is an understanding of what the heck is that language? And that involves then a bit of translation of the acronyms that come as part of this part of our world. This screenshot is taken from the CMS website, and you see that, gee, there are 4,420 acronyms. This is a great way for you to communicate better with the population that you're visiting with, but also set yourself up as a subject matter expert, because I don't know of anyone human that has all the answers. And in this particular instance, having a guide to help you with some specific questions that are punctuated by an acronym that you may not know off the top of your head, a great way to properly communicate then with a translator guide in a manner of speaking. We look at the different pieces that comprise the Medicare market, and the folks coming off of the marketplace plans are just one parcel of that. And we see that the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day, it's a near incremental increase exponential, I should say, increase in the number of people eligible for Medicare based on age. But we find an increasing number of folks that are deferring accessing Medicare benefits for one reason or another. A lot of it goes with group benefits. Some of it may be a continuation under the marketplace in certain circumstances, rarely. But for whatever reason it may be, it's more than made up for by the portion of the folks that are qualified for Medicare based on disability. So it's obviously a very large market, and the marketplace agents, in a manner of speaking, are just a part of it. Huge numbers. You look at it. As of September of last year, over 65 million people enrolled in Medicare. Wowzers. How many of them are coming off of marketplace plans? Don't have those numbers there specifically for you, but it's a pretty good amount. And what we want to make certain then is we have the programs that can address the options that they have aging into Medicare. They may choose just to go with traditional Medicare, self-insure for the shortfall in the financial outlay, pick up a Part D plan for the drugs. Some might go with a modernized supplement plan. Some may bundle all their benefits into a Medicare Advantage program. But what we'll see in many circumstances is a population that is accustomed to either getting a fairly large subsidy to drive down some of the cost, or they'll look at some of the different programs and the metallic choices that they've had and look at the out-of-pocket exposure they have and realize that Medicare and some of the programs that are there for them may be more extensive coverage than what they've had in the past. So it's important for us then to look at this and help them review their coverages, because statistics show us, Kaiser Family Foundation in this particular instance, telling us that the majority of people on Medicare don't look at their plans year over year. They're not doing that annual review. They're not doing it regardless of what their base programs may be. And this may not be an entirely big factor for folks that are coming off of marketplace plans, but if they haven't done it this year, they sure will in the future. And because of some of the opportunities we have to translate and to remind them of different opportunities they have to learn more through governmental programs and informational plans as well, it gives us the opportunity then to visit with them about the options that they have. And this is a core point that we need to really be aware of, because it's not just the timing of when they're actually leaving the marketplace for Medicare. It's also then a timing as to, well, at that point in time, did they have all the information they needed to make the best choice, in a manner of speaking, for themselves? And how did they come about that information? So we want to make certain that the detail that we offer is delivered in a fashion that is acceptable to the population. So does that mean we have to visit them in person? Does that mean we deliver things by virtual means, Zoom calls, emails, whatever it happens to be, or a kind of a hybrid situation? Whatever it happens to be, we're looking at a population that's increasingly digitally savvy. And if we have someone coming off a marketplace aging into Medicare, the probability of them being more comfortable in receiving information on an electronic basis might be even higher than what we've trained them, we, the proverbial we, all providers of care and information disseminators, have done particularly since the pandemic hit. Doctors, specialists, hospitals, dentists, even faith-based organizations are delivering their services digitally, and folks are becoming much more adept at receiving that information and understanding it through this means. So this gives us the opportunity to deliver the information in a timely, compliant fashion, but it also gives us the opportunity to do some things on a very timely basis and make certain that we can fit the timetables that come into play when we're looking at someone who is perhaps leaving one coverage for another. Folks that are coming off a marketplace, well, they may not be subject to these particular election periods that we see for the general Medicare population, but we have a ton of special election periods, much as where some of these folks had during their stay in the marketplace, but we have opportunities to change throughout the year. And we see in many markets that this may be an option to change throughout the year for the majority of people. And these are added to by the special election periods that come about as well. So the reminders we get from the carriers really help us to look at and handle these situations in a compliant fashion. But specifically, when we look at Medicare and the marketplace, we need to really have the detail at our fingertips as to what makes the difference. And so what we have done is we have taken a presentation straight from the Medicare Learning Network. These are presentations that are available to the general population, as long as you know where to look. But this is also a presentation that not only gives us the detail and the knowledge to speak to the folks in a proper fashion, but this could very well be one of the tools that you use virtually or in reality in presenting to groups as well. So this is something for you to consider if you are one of those individuals that frequently present to the Medicare population. If you're doing it virtually or if you're doing it live, there are a lot of centers of influence in the community that really need our help in educating the population we serve, and this is a great way to do it. So as we go through this, it gives us the details of what we're speaking to. It allows us to address the turning 65 population, make allowances for those who are enrolled in SHOP coverage, small business health options programs, and give them the detail, or many of them may be accustomed to having credits for the cost of their programs in the marketplace. Are there similar programs that we have in Medicare that can help them with some of the costs? This gives us some of that detail and then goes through the different Medicare periodic data matching programs that helps us explain that piece of it as well. So we want to make certain that we cover extensively the information that's needed for folks to make an informed decision as to what they do next. And it gives us then that opportunity to go through and visit on that agenda. And the first one of those that we need to address is the obvious situation for the folks that are turning 65. This gives us then the opportunity to speak to the fact that the marketplace open enrollment notice is sent, and it tells the individual that they may be eligible for Medicare and can change their health coverage when they turn 65. They speak of the different ways that are available to sign up for Medicare, and a bit of a warning as to there may be late enrollment penalties if an individual doesn't sign up when they're first eligible. It is important to note too that the individual can cancel their marketplace plan once they sign up for Medicare. This may cause a bit of concern for some folks, but generally, when they look at the benefit packages of what they have versus what may be available for them, it can be a great difference for them. And as a reminder, today's presentation is being recorded and will be made available on our website, our YouTube channel, and through your agent success manager with Premier as well. So one of the things that folks need to look at when they enter into a discussion about Medicare is an understanding of the different parts. We hear a lot about the alphabet that is associated with Medicare. And what we look at is for those individuals that are enrolling in Medicare Part A, the hospital coverage. And this is a coverage that most folks don't pay a premium for if they've worked the requisite amount of quarters. And the premium for this can go up 10% if an individual doesn't buy it when they're first eligible, 10% per year. If a person is on Medicare, they cannot contribute to a health savings account, which they may have done prior to Medicare eligibility. And once a person's on Medicare, they're no longer eligible for that marketplace premium tax credit and cost sharing reductions, which is one of the great enticements as to why people have that coverage now as it is. Part A is considered qualifying health coverage as well. So we want to make certain that folks are available, or the information is available to them about this portion of the Medicare coverage. We also want to make certain that folks are understanding what it takes to enroll in Medicare Part B. And this is a circumstance where most folks pay a Part B monthly premium. It's deducted automatically from Social Security or the railroad retirement benefits. And if a person doesn't have that set up yet, because some folks may defer to pull Social Security, for those of us who are at the tail end of the baby boomer generation, well, we don't get full Social Security until we hit 67. And so some folks may not be pulling Social Security at that time, but they have options to pay the premium for Part B. They can pay it online through the Medicare account that they've established through Medicare.gov using a credit card or a debit card. They can pay directly from a savings or checking account through the online bill payment system. There's a system they can sign up for Medicare Easy Pay, and a person can actually mail their payment to Medicare. It's important to note that folks don't have to sign up for Part B, but if they get it later, they may be subject to a lifetime late penalty enrollment here as well. So we want to make certain that folks realize that it's not just picking up the coverages, it's when that's being done. There are circumstances where a person is automatically enrolled in Medicare, and this is for folks that have that Social Security benefit being drawn, the Railroad Retirement Board being done as well. And for these folks, they're getting a nice package of information from Medicare that speaks to getting ready for the Medicare coverage. It's mailed 3 months before the individual turns 65 or on the 25th month of a disability benefit. Remember going back to that slide that said a little over 17% of the Medicare population is under 65? Well, that's because of disability. This packet also includes their Medicare card. Looks a little bit different than it did in the past, or in the past it used to have a number assigned to it that was basically a Social Security number. That's changed. So some different things that come about in that regard. There is the initial enrollment period that an individual has for Medicare. And so when we speak to folks that are coming into Medicare off the marketplace, it's important that they understand that if they're not getting Social Security at least 4 months before turning 65, they can sign up for Part A and Part B during their IEP. This starts 3 months before their 65th birthday, including the birthday month, and then ends 3 months after the 65th birthday. They can enroll in these programs then through Social Security or the Railroad Retirement Board, and the coverage begins based on the month that a person enrolled. Obviously, if they're enrolling before their 65th birthday, in those 3 months prior, it begins on the month of their 65th birthday. If they've bypassed that month, gone past it, it will be the first of the month after which they have enrolled. There are some qualifying factors or some factors that can come into play that may influence the premium for Part A, and that includes the end-stage renal disease challenge that some folks have and how that can affect their payment and their signing up for Medicare. If a person misses that IEP, they'll have to wait until Medicare's general enrollment period, a GEP, which is the first 3 months of every year. So as this recording is being taken place in February, we got 1 more month for folks in this GEP eligibility period. This coverage then begins the 1st of July. So you have folks that may enroll in Medicare in January and don't actually have the coverage until the 1st of July. It's important to note that if more than 12 months have passed since a person's turned 65, there could be that 10% lifetime late enrollment penalty. There are some changes that have come about the 1st of this year, and that includes folks that are enrolling in a Medicare Part B during the last 3 months of their IEP or during the GEP will have coverage starting the month after enrollment. So they've pushed it up from what it's been in the past. And depending upon the individual circumstance, they may well qualify for a Medicare special enrollment period that gives them the opportunity to look at additional coverages that can help them with the shortfall of the financial coverage or types of coverage with original Medicare. We also want to make certain that we're not double covering people. And so how do we cancel marketplace coverage because of Medicare eligibility? Ending that coverage due to that eligibility is different depending upon who's ending the coverage, because it's important to note that many of the plans of the marketplace are not just the individual. There may be household individuals, folks that are involved as well. And so this is an important thing to consider as to how the individual proceeds. In my own personal situation, my father was 7 years older than my mother. So you have a little bit of a time lapse there as to who's eligible for what. And that's something you really need to take into account. If we look at the cancellation on an individual, we can request that that coverage ends immediately or request a date in the future. It's important to coordinate that end date and start date of other coverages so we don't have a lapse in coverage or a period where we don't have coverage at all. In some cases, the coverage won't end immediately, but a person can end that coverage by logging into their healthcare.gov account if they're the only one covered, or call the Marketplace call center to accomplish that fact. You do have additional information available on healthcare.gov on how to cancel a marketplace plan as well. When we look at the household program, however, it's important in this circumstance that the call is made to the Marketplace call center on the day that the member's coverage is to end. We don't want to change or end that marketplace coverage online unless you're ending coverage for everyone on the plan. It's an all or nothing type of deal there. In most cases, the removed member's coverage will end right away. So then we have to make certain that we time things properly. Now, to keep a marketplace plan and Medicare, this is a little bit of a anomaly in a manner of speaking, because once the Medicare Part A coverage starts, it's important to consider that the marketplace coverage duplicates the coverage a person can get from Medicare, and that person no longer qualifies for those advance payments of the premium tax credit, that APTC, or other cost savings they may be getting for their marketplace plan. And that can radically change the financial dynamic, of course. They'll have to pay full price for that marketplace plan. And Medicare doesn't coordinate benefits with marketplace plans and doesn't work as Medigap or secondary coverage. It's important to note that there's little to no benefit in keeping marketplace coverage once a person is eligible to enroll in Medicare. Personal experience, the biggest challenge I see with a lot of folks is change is not easily accepted. It's getting into a new system. And then, of course, it's the reluctance to change something that may or may not have worked well for them, but is there for them. So we want to make certain that that is taken into account. If a person is not eligible for the premium-free Part A, they can choose to keep their marketplace plan to get the coverage. And in that case, it might cost less. And at the end of the plan year, the federal marketplace may end the marketplace coverage if it duplicates that Medicare coverage. It's important to note, once again here, if you're not eligible for premium-free Part A, the vast majority of people are, but there are people that have to contribute to that cost, even partially or the full amount, depending upon the number of quarters that they've worked and paid into Social Security. If an individual wants to keep their marketplace plan instead of Medicare, well, there are situations where that can happen, and they can keep the plan with premium tax credits. If the individual's eligible for Medicare and hasn't enrolled because they'd have to pay that premium for Part A, they got a a medical condition that qualifies them for Medicare, like the end-stage renal disease, but they haven't completed the application process for that. Or if they're in the midst of their 24-month disability waiting period. If a person's enrolled in Medicare and they're paying for Part A, or if they only have Part B and would have to pay a premium for Part A, this is something where consideration of staying in the marketplace may be a viable factor. Bear with me a moment. I've got a couple questions popping up. I'm going to address them in just a bit. Hang with me. We want to look at other considerations as well, because there are marketplace plans that may not pay claims that would be covered by Part B if they're eligible for Part B and didn't sign up. If a person delays signing up for Medicare and decides to sign up later, remember, you got to go through that GEP, general enrollment period, or a special enrollment period. If they qualify, they can be responsible for a lifetime Part B late enrollment penalty as well. And if the Medicare is ended retroactively, you'd have to pay back any claims that Medicare paid during the time period where that coverage was in effect. It's not likely that folks will benefit from choosing marketplace coverage other than Medicare. I know we said that a number of times here, but it's something to very closely consider. And if you use the Benjamin Franklin T close type of situation, advantages and disadvantages, that can become very evident when you're doing an apples to apples comparison on claims. So a little bit of a check here. If you delay signing up for Medicare and decide to sign up later, you can sign up only at certain times if they qualify, and there may be a late enrollment penalty involved. So that's something to really keep in mind as well. So let's check then really quickly on the questions that I mentioned that popped up. Bear with me. What types of individuals would not get free Part A? These are folks that have not paid into Medicare more than the 10 quarters that's necessary to fully fund that, or be married to someone who has done that, or if they're a child, the parents, they look at the parents and what they have done in that circumstance. It is not a large percentage of the Medicare population, but it is something to really consider. When you look at the different cost of these coverages, and that includes folks that are in the highest IRMA brackets, these are folks that pay much more for the Medicare. They may have a different premium involved when it comes to marketplace plans. Can they drop Medicare to go with the marketplace plans because they can afford those premiums and the oops? I'm going to look you square into the computer monitor and tell you my first inclination would be no. That would be a lot of hoops to jump through if you could even accomplish it, and I don't think that could happen. But hey, I was wrong before, but I was wrong about it. Let's see. And I think that covers the questions that are pertinent at this particular point in time. So keep in mind some of the things that we need to review when it comes to how a person enrolls in Medicare. We then need to look at some of the folks that are involved with the Small Business Health Options Program, the SHOP program in Medicare. And this is a program that you see that if you signed up for notifications from Medicare.gov, which I recommend everyone do, you see that this particular type of coverage is trumpeted with a notice of speak with your broker, which is a really nice thing to do, or a really appropriate thing to do. And we don't see that across the board with all types of coverages. This is a program that is for small employers who want to provide health and or dental coverage to their employees. It's available through the carriers themselves and through agents and brokers. And in this particular instance, it counts as creditable coverage, so that recipient could delay the Medicare Part B medical coverage enrollment if they have SHOP coverage, and do so and defer picking up that coverage and not be subject to a penalty. This is a circumstance that when the SHOP coverage ends, that individual will have a special election period to sign up for Part B without penalty, and it's available anytime the individual is still covered through current employment or the employment of the spouse. And it's an 8-month period that begins the month after the current employment ends and the SHOP coverage ends, whichever happens first. If a person doesn't sign up during that special election period, they may have to pay a Part B late enrollment penalty for as long as they have Part B. It doesn't go away. And they can only sign up then during the Medicare general enrollment period. And remember, that's January, February, and March of each year with an effective date of July 1st. So when we look at this and we speak to, does an individual have to enroll in Medicare Part B if they have a SHOP coverage? No, they don't. Remember, because it counts as creditable coverage. Once they drop that coverage or it expires or they leave, then they have that special election period to enroll in Medicare Part B at that time with coverage at the first of the month. This is a section that may have particular pertinence to folks that are in the Marketplace program and they're receiving the premium credits. And these are programs that it behooves us to know a bit about because they help pay for the Medicare coverage that an individual has or the cost associated thereof. And these Medicare savings programs are different programs that are a joint effort between the state and the federal government, administered by the state. It's all based on income and assets. And it is a program that allows an individual to get some assistance at this time up to 135% of federal poverty level. And it can make a big difference for those individuals that qualify for the coverage, obviously. And these are many of the folks that are accustomed to getting assistance with paying for their health care coverage through the Marketplace. We have a full webinar series on these. I have an updated one coming for you this next month on the Medicare savings programs, but these programs offer different levels of assistance based on the type of coverage that they qualify for. We want to make certain that folks also realize that there is a program to help them with the cost of their medications. So the Extra Help program, the low income subsidy, this is a system that is set up for folks that helps pay for the cost of the drug plan and affects the coverages under that drug plan as well. It goes up to 150% of federal poverty level. Some of that has changed over this year as to partial versus full coverages, but it can make a big difference for that individual, regardless of the health plan that they select. It deals, however, with monies. It doesn't deal with the coverage itself. So someone who qualifies for low income subsidy, it takes care of deductibles, premiums, co-insurance, things of that nature, and has a continuous special election period once per quarter during the first 9 months of the year. But the plan that they select, it doesn't affect the formulary, the drugs that are covered. It doesn't affect any step therapy, steps they have to take, an individual has to take for coverage on particular medications, and it doesn't affect quantity limits as well. But it does help with the costs. So that's something that can be of great help when you deal with a Marketplace individual or a soon-to-be ex-Marketplace individual, and they're wondering, how am I going to pay for some of this stuff where I never had to in the past? Well, let's see what they qualify for and what kind of help that we can get. Whoops, pardon me. Qualifying for these coverages, well, the government does a pretty good job of making information available about this, but a person qualifies for the extra help on their medications automatically if they have Medicaid coverage, if they're on SSI, the supplemental security income piece, or if they're getting help on paying their Part B coverage through the Medicare savings programs. So it's a ride-along kind of assistance program if they have these other coverages. If an individual needs to apply, they can do so through Social Security's website, as noted here. You can actually help them with that application process compliantly as an advocate, or they can call Social Security and ask for the application. Don't do that. If you can, do it online. They can contact their state medical assistance office, Medicaid, try to get an appointment to get help there, or they can work with a local organization such as a SHIP program, the State Health Insurance Assistance Program. Or they can get help with these programs through a knowledgeable broker such as yourself, a line that's not there, but is part of the equation. To find out if an individual qualifies, well, they need to review their income and their resource guidelines. That's part of the detail that we have in our other series as to what those are. They change each and every year. The numbers coming out should be out here very shortly for 2023, and that information is available through those different resources as well. We have great faith in the National Council on Aging and some of the information they kick out. We use that in a lot of our presentations, as can you, and we have that available for you as well. Let's see. So once again, keep in mind that this presentation is being recorded, and the presentation itself that we're going through right now will be made available to you through your Premier Agent Success Manager, your marketer within our organization. You can pull it off the Medicare Learning Network as well, as I did with this presentation. The challenge we have with emailing it sometimes depends upon how well your server and our server gets along as to whether or not it can get through, because it's a fairly large presentation. Let me show you really quickly here. What's nice too is it's got the notes there for you, so it helps you visit knowledgeably. And hey, on this slide, what should I say? I'm going to confess, I read through it. I don't memorize it, but it's very helpful for those that may not be as familiar with some of the lessons that come with the presentation. Very helpful though. So if a person automatically qualifies for extra help for Medicare drug costs, if they're getting help from Medicaid, paying their Part A and or Part B premiums, do they do that? Do they automatically get that extra coverage? And that, of course, we've beaten that horse to death and are beating a dead horse now. It is true. It comes automatically with certain other coverages. When we look at the Medicare periodic data matching programs, what are we talking about there, John? PDMs. Well, these are notifications we get from the marketplace if you have Medicare and a marketplace plan and are getting premium tax credits on their cost sharing reductions. This will tell the individual, well, give them the information of, hey, it's you. It's a recommendation they should end their marketplace coverage. It gives them instructions on how to do so and the date that is necessary for the reply to come in order for the action to take place. It's also important because it gives them contact information to confirm when a person's enrolled and if they have questions about Medicare. Keep in mind, as a qualified informed insurance agent, you can help with this process as well. It gives them then the information they need to know about, hey, marketplace is going to end those premium tax credits and or cost sharing reductions if they're enrolled in Medicare in the marketplace. And it's added a statement to the application to act on behalf. So it's something to really be aware of, because these folks are going to go, well, hey, all of a sudden I'm not getting this help, and that silver plan that I'm on is a few $100s more than it's ever been, maybe more than that. Well, that is a call to action. We'll put her that way. If a person has both Medicare and a marketplace plan, they got 30 days from the date on the notice to return to the marketplace to either end the premium tax credits or the marketplace plan, and to get those specific instructions based on the Medicare enrollment status. They also have the option to disagree with the results and change the response from agree to disagree if they no longer want the marketplace in their coverage. So some different things that we need to be aware of when it comes to dotting our I's and crossing our T's. So if an individual has a marketplace plan and they're eligible for Medicare, or pardon me, for premium tax credits, cost sharing reductions, even if they have Medicare, is that the case? No, it's not. When someone has Medicare, those premium tax credits and cost sharing reductions go away. Let me peek at something. I have a question popped up. Deborah, I'll make certain that you get the presentation as well. But newly 65 has applied for Medicare through SSA. What's the approximate time frame to receive a new Medicare card? And if the card is taking longer, what's the best follow-up number? Supply chain issues are across the board. In this particular circumstance, it's not a question of having paper to print the card or that kit. It's a question of having staffing in place. Generally, they receive that information very quickly. Exact timetable will vary according to the individual and their circumstance, but there is the 1-800 Medicare number that they can use to follow up. One of the things that I would strongly recommend in any of these circumstances to check on an individual's circumstance is to not rely on telephonic assistance. It is to make certain that the individual has a Medicare account set up in Medicare.gov. It is theirs, it's secure, it has all the details within it then as to their status and timetable that is involved. I can't stress enough how valuable that account can be to the Medicare beneficiary and to you in helping them with the information that they need. There are different ways that we can do some things online, obviously, to get additional information about Marketplace. For those of you that have been active in this segment of the insurance world, you're probably well aware of these. For those of you that have concentrated more on the Medicare side of it, well, here's some things that can help. And once again, trainings are available from the government as well. It's always nice to have the information in the organization's particular vernacular. Keep in mind this presentation is doing exactly that as well because of where it came from. Healthcare.gov website gives us a lot of the information. It gives us the information to make certain that we stay on board with the coverages now until the person comes on Medicare. It makes certain that they realize that it's a way for them to also seek help. So if you have folks that are in this circumstance, you want to make certain that you stay in contact with them because they may be reaching out for assistance through this system. And that search for a local agent, broker, or assistance, or being contacted by a local agent, broker, that may well not be you. So you want to make certain that communication is really, proper communication is really being put in play. So additional website information that's available. The navigators and assisters. Remember when these programs were rolled out, there was a lot of hubbubaloo about that and the training that these folks had or didn't have and the costs that were associated with them. But these folks can help this population if they aren't eligible for Medicare and want to enroll in Marketplace. Taking away that part of the business helps with the understanding of options in this circumstance and managing the Marketplace plan. It also helps the individual understand options for enrolling in these programs, understanding the factors that come into play when it comes to ending coverages, rules for ending a Marketplace plan if a person becomes eligible for Medicare, speaks to that advanced premium tax credit, and refers many people to the SHIP counselors. Keep in mind, you have this information in your pocket. It eliminates the need for all of this and establishes you as the subject matter expert and the individual that has the information needed for these folks to make proper choices. So let's look at a Marketplace scenario. We've got Ms. Stone here. She's wondering if she has to drop her Marketplace plan now that she's eligible for Medicare. She's turning 65 next month. Her full retirement age for Social Security is 66 and a half. She was married for 15 years. Her former spouse worked for over 40. She's got a Marketplace plan, and she qualifies for a premium tax credit and cost sharing reductions. Must Ms. Stone drop her Marketplace plan now that she's eligible for Medicare? No, she can keep it. And why? Must she do that? Well, she should consider enrolling in Medicare and ending her Marketplace plan when Medicare is effective, because there's no coordination of benefits between Marketplace plans and Medicare is going to be her primary payer, and Marketplace will end her tax credit, so she's going to absorb the full cost that she's not accustomed to doing in the past. And she'll be getting that lovely little notice that says her plan may be terminated. What does that do to most people? Well, it sets a little fire under folks and does create a bit of panic in certain circumstances. So when should that Mrs. Stone enroll in Medicare? She should do it now, because if she waits till she turns 65, timetable might be off. And obviously we want to make certain that she enrolls so she doesn't become subject to penalties for enrolling late, not having the proper coverage. This is important because she's going to be in her initial enrollment period, and this is her first opportunity to sign up for Medicare. And if she enrolls during this time period, she doesn't have to worry about those late enrollment penalties that I alluded to just a moment ago. What should she consider if she enrolls in Medicare? Well, she needs to look at some of the different coverages that are available to her. Does she qualify for a Medicare savings program because of income and assets? She's getting credits under the Marketplace plan. That's a possibility. Does she look for other coverages? Yeah, she needs to look at Medigap, PDP programs, Medicare Advantage programs, and see what best fits her. So she needs to be aware of the fact that the cost of her Marketplace plan will increase once Medicare starts. And some folks just don't understand that with, well, hey, this has worked so well, I'm not going to use Medicare, I'm going to stay on Marketplace. Well, they may be a tad confused about that, to say the least. What does Mrs. Stone need to know? Ms. Stone needs to know about Marketplace plan once her Medicare begins. She needs to know. She needs to return to the Marketplace plan and notify them and ensure that her tax credit and CSR has been terminated. If not, they're going to come back for that in the future. The cost of her Marketplace plan will increase once she gets Medicare because she doesn't qualify for those tax credits anymore, and she'll have to pay the full monthly premium for that Marketplace plan and full out-of-pocket costs once she gets services. This may well be that big determining factor because it's not an affordable option moving forward. How would Ms. Stone's situation be affected if she never married? Well, look at that. All of the above. It could affect the number of work credits she has. It could affect how Social Security would determine when she pays the premium for Part A. It might find it more affordable then to stay in a Marketplace plan and not enroll in Medicare. So there are a number of different options that can come into play, circumstances that determine what might be the best choice for her. What would have happened if she never got married? Well, since Mrs. Stone didn't work enough in her lifetime to get Social Security benefits she had never married, she might pay that premium for Part A. And in limited circumstances, she might find it more affordable to continue with Marketplace coverage and choose not to enroll in Medicare. She's getting a tax credit and CSR, she can keep it as long as she's not in Medicare. That requires her to be proactive before that Medicare coverage kicks in. Key points to remember: Medicare isn't part of the Marketplace, and most times it's best to have Medicare. If an individual has premium-free Part A and looks to keep the Marketplace plan, they're going to pay full price for that Marketplace plan premiums. They might have to return to the Marketplace to end the tax credits, and they may have to pay back all or some of the premium tax credit paid on that individual's behalf for those months of overlapping coverage. So it can be really a big hit financially. Additional key points: if an individual doesn't enroll in Part A, if they had to buy it, and Medicare Part B, the medical and coverage during their IEP, that initial enrollment period, they may have those late enrollment penalties for both coverages, for A and for B, separate penalties, and a gap in the coverage if they have to wait until that Medicare general enrollment period. Remember, January, February, March, or a July 1st effective date. You might have to pay back all or some of the premium tax credits after becoming eligible for Medicare Part A. Timing is all important when it comes to the cancellation of those plans. And if the individual already has Medicare, they probably can't enroll in Marketplace. So that might be a way of directly addressing the question that came up as to if they have Medicare, can they not enroll in Marketplace? That was spoken to earlier. Websites and resources, keep in mind, these are there for you to use, and they're a great tool to go and become more comfortable in the discussion. Reviewing this presentation, of course, would help too, but that is up to you. Acronym guides. I already talked about that 4,420 acronyms that are available on the CMS website. This is really a ground down acronym guide here, but you have that other resource to access to go through and translate what some of these different acronyms mean. MIC, KEY, MOUSE. No, I don't see that on there, but these are the ones we run across very frequently. It is important to note too that as agents, we have an opportunity to always stay in the know. I really appreciate folks that come on and visit with us during our presentations. Timing is sometimes a factor. We have them recorded and on our website and our YouTube channel, but getting information from CMS's national training program, that's where I pull a lot of my data. That's available, and you can obviously subscribe to an email list as well that gives you different notifications, ways of contacting them to make certain that you have the most recent material. That is my biggest point of frustration with the national training program, is sometimes the lag of when a program is effective and when you can get current detail. Why do you want to do some of that through us? Well, we want to make certain that all of this information not only comes to you from governmental resources, but we're available to you as a resource as well. And as a person rolls out of the marketplace in the Medicare programs, they may have more flexibility in picking up additional coverages, so cross-selling opportunities, but also ways that you can make certain that you are the individual that helps them with the base coverages they have in addition to just traditional Medicare. And so having an electronic means of doing contracting can be very helpful. Our Sure LC program can help you in that regard as well. For some of the big carriers, we're going to do direct contracting links to expedite the process. But this gives you an opportunity to create an agent profile, have your data in there, and contract with carriers that are appropriate very efficiently and effectively. We also want to make certain that we cover your financial wherewithal in a manner of speaking. So we offer a discounted E&O program for qualified agents, and a qualified agent, someone who contracts with us. But this is a program that you own. Premier is a large organization. We have a very vast portfolio. We're not everywhere with everything. I don't know of anyone that is. However, I don't know of a lot of insurance companies now that don't require errors and omissions coverage. This is a program you own, so it's not like being added to a blanket E&O for one policy or one program and then figure out how you get coverage elsewhere. It takes it wherever you want to go and with whomever you contract. We also help in maintaining your insurance license through discounted continuing education courses through our affiliation with WebCE. As an independent broker, you're responsible for your own insurance protection. You may well be on a marketplace plan yourself. However, that doesn't come with disability income insurance. And this gives you the opportunity for accessing those programs on a modified guarantee issue basis on which you're paid a commission on writing policy for yourself. I mentioned repeatedly that these programs are recorded and made available both on our website and on our YouTube channel. You have different ways of reaching into the community to make them aware of who you are and what you have to offer. We went through a presentation here at length that speaks to Medicare and the marketplace. It may well be something you want to use in your community. How do you do that? How do you approach centers of influence in the community, faith-based organizations, other organizations that can make a difference in disseminating information to your target audience? Well, we have programs in there in this recordings that help you with that. How do you approach faith-based organizations? How do you work in that circumstance? How can you speak intelligently to providers in this regard as well? So some great tools that are available to you there 24/7. We also make available to you complimentary access to our electronic tool called Medicare Center. I cannot oversell this program. It's a system that allows you to access multiple quoting engines through a single login and then disseminate information and retain it compliantly. So collecting those scopes of appointment that's necessary, storing them for the 10-year period that's necessary, if you sell them or not, call recordings for Medicare. I took 3 solicitation calls today that, well, the call terminated pretty quickly when I asked them if they were recording the call, which means they weren't, which means they weren't compliant. Well, hey, they're calling for MA anyway, you can't do it. But this gives you the opportunity on a compliant basis to take care of that requirement, and then gives you the opportunity to to send out side-by-side plan comparisons in different fashions to disseminate the information you want in the hands of your prospects and clients. And that includes using a presence on the internet. You have a personal URL, a microsite that is available that you stock with the programs that you have with our organizations through the Integrity Platform partners, where that person can go and shop on their own, enroll on their own, and it's your client in your commission. Keep in mind, studies have shown the folks that are aging into Medicare, they're shopping before they talk to people. They are also doing a lot of self-servicing, and this is a great tool to help you with that. And in order to track all this information, you do have a CRM available in the system too, a contact management system complete with switcher tags. What's a switcher tag? Well, that's a notice that gives you a identification of folks that may be more susceptible to a change or in need of a conversation to keep them on the books one way or another. A great way then to make certain that you can prioritize the calls within your contact management system. Lead Center we're talking about in just a little bit, but the Learning Center is also a piece in there, that gives you the opportunity to better your skills. If you got people raising your hand and you're closing 35% of them, what's the difference if you close 50%? Because you are more skilled at doing so. That can make a big difference for everything down the road. The system is also available as a mobile application, and to paraphrase one of the quasi-celebrities on the TV commercials, it's free for agents that are contracted with us. We want to make certain too that you receive full compensation for your services. Many of the carriers in certain parts of the insurance world will offer additional incentives. That includes Medicare supplement plans, not a case with Medicare Advantage or PDP programs, max comp set by the government with those plans, but like the ancillary programs, the dental, the cancer programs, HIP programs, whatever it happens to be, hospital indemnity programs. These may help you qualify for carrier trips and will help you qualify for premier incentive programs as well, marketing assistance, and the return of our producers convention, a great trip that you can qualify for doing business with our organization. We want to make certain that we get you in front of folks as well. So we have contact lists that are available to you, butted up against do not call, low or nominal fee for them, for programs in which you're able to cold call. Keep in mind, the effectiveness of some of those programs may be adversely affected by some of the technology that's out there. You know, they're like, hey, in the past, phone ring, you had to pick it up to figure out who was calling you. That's not the case so much anymore, but we want to make certain that if that's something that you do, you have a good relationship with Ma Bell, we help you. We do want to make certain, however, that you can leverage those centers of influence in your community that I alluded to a bit earlier, including talking to faith-based organizations, working with providers, and maintaining and strengthening a relationship you may have through retail marketing programs that you've participated with in the past or are looking to in the future. Some of the carriers in the insurance will generate leads for you, but it's mostly a quid pro quo situation. You scratch my back, I scratch yours. Knowing your agent contacts for different carriers in the area is paramount to success in that area. We do have social media lead campaigns that are available and direct mail support. Talk about that Lead Center in detail in a second. There's a T65 locator program and a referral system that helps us cast our bread upon the water and let it come back multiplied. That direct mail support's based on production, drives down the cost, so you can do direct mail consistently. It's the old Mark Twain adage of, I'm not dead. Well, the reports of my death were greatly exaggerated, or my Monty Python one of, I'm not dead yet. Direct mail's not dead. You're going to have consistency with it, and utilizing this, well, you can qualify for it twice through health programs and through final expense, utilizing vetted lead vendors that have systems to deliver the leads to you quickly and accurately, and do so through outreach that is compliant. We also have a system to fill in the holes in your calendar for direct mail responses that never been touched, fresh or a little aged. The cost will vary from area to area and from time of year to time of year, but it's a great way to fill those holes in your calendar and speak to people who have raised their hand with interest in different programs that are out there. We have a couple of different internet lead programs now. This one, it allows you to access leads for final expense or for Medicare through a third-party vendor. Keep in mind, internet leads are microwave in mentality. You have folks that you'll get a response quickly, but they expect a response quickly from you as well. We also have another program recently introduced that maximizes the return on interest for folks through search engine optimization. So we have a couple of these programs that you can discuss with your agent success manager. Lead Center, I bounced on this twice already, but this is a program available through Medicare Center for leads that are sourced through multiple means that you can turn on and off according to your schedule, according to your budget, whatever. They can be live transfers or data that is injected into your CRM in the system. You control the flow of the leads, you can control the monies you spend, and it's a great way to make certain that you have that constant flow of people to speak to that have expressed interest in different programs that you offer, and gives you the opportunity to be successful year-round. A T65 locator, it's a piece you download onto your smart device, you register, they see that you have a contract with us, and it enables you to set up different parameters and find out where people live according to that. So it's a great help for you in that fashion. For folks that are door knocking properly, perhaps for med sub, final expense, or dental, it is a way for you to perhaps fill a hole in your schedule if you've slotted appointments in a particular area, one cancels, or for whatever other means for marketing. Referral program. It reminds us of asking before, during, and after a sales presentation if they buy from you or not, but it's also a means to keep our book of business engaged by going back to them, accessing that information through the CRM that you have with Medicare Center, and say, hey, I now have access to a great dental program that can help people in this fashion. Do you know of people that might be in need of that help? Well, the first things that'll pop into mind is, well, hey, I could use me some of that too. So it's a great way to engage your book and put additional product in play as the need arises. We do all this because I'm flipping through slides here to confuse you, because we want the opportunity to work with you. We want to make certain that we're referable to you and your agent cohorts, and we ask for that, plain and simple. The information we generate and get out to the public, we don't charge for it, but we want to make certain that you have access to it and that you realize that we're that source of information for you as much as possible. And because this circumstance, when we speak to Medicare and the Marketplace, if you've got contracts in play, you're already certified, and some other pieces there, it's pretty simple to move forward. It's a question of then being knowledgeable on how to handle people that are in the marketplace and how we can do that effectively moving forward. So I'm going to check really quickly to make certain that we've covered questions. It is recorded. Got information on IRMA. Types of individuals that wouldn't get free Part A. Where do you get these slides? Time frames for Social Security. Yeah, I think we've got her taken care of here for you. So at this point in time, for those of you that have done business with us here at Premier in the past and are viewing this presentation, I sincerely want to thank you for that business. I look for an opportunity to help enrich that relationship, but thank you for what we have done together. For those of you that are checking us out, hey, I appreciate the opportunity to earn your business as well. We have very knowledgeable people within our organization that can be a great asset to you. But most of all, since I've gone a little over the hour now, I do it anyway, but I want to thank you for investing your most valuable resource with us, and that's your time. It's greatly appreciated. We hope that you garner something of value from this presentation and make certain that we are able to deliver upon it. And so, until we're able to speak with you again or address any questions or need that you may have in the near future, well, we wish you good health. Thanks so very much. We'll talk to you soon.